The deaf community is what we call a linguistic minority community. They get often grouped into the disability category, which in some ways they are. And for some reasons, they may be seen that way, but we prefer to call them a linguistic minority because that's sort of that's what identifies them as their group. They're not defined by their disability. I have asked Jen and Pam if they wouldn't mind to take a few screenshots during the presentation. So if you don't want your picture, perhaps shared at some point in a positive way, then you can keep your video off. But I just want to give that disclaimer. So yeah, we'll go ahead and dive into this. I have allowed time in this hour that we have together this afternoon for questions. So feel free at any point if there's anything that I don't explain clearly, or if I, sort of jump into some words or jargon that I'm familiar with just being in this field that I may not explain as clearly as what I think is coming out of my mouth, then please feel free to interrupt. We have folks watching the chat for you can put your questions there. You're welcome to come off of mute and ask your questions and stop at any time. So don't feel any hesitancy to ask questions. Just a little bit about myself, and I want to give you some background of who I am and where I work. So hopefully that'll set up the presentation. I've been at Bridges for the Deaf and Hard of Hearing for 21 years. I came in as a staff interpreter straight out of college almost, and have been just sort of moved up ever since. So I've been in the field for a while, and I've seen a lot with the deaf folks not having adequate access, not necessarily to your services, but just services in general. So that's sort of what we're going to talk about, some barriers and how you can help tear those barriers down so that when you do have, albeit probably very rarely, the case where the individual who is deaf or hard of hearing comes to see you for help and for assistance, it won't be completely foreign to you, and you'll have a little bit of knowledge of how to handle them. Personally, because I specialize mainly in legal and mental health work, you could see where that would overlap with some of the work and services that you provide. Our the office that I work in is in Nashville, Tennessee, but I live in Franklin, which is about 20 miles south of Nashville. My youngest son is graduating this afternoon from high school, and my oldest son he'll be a junior in college. So been here for a while. Love the Middle Tennessee area. As I was looking at some of the locations where you're from, I haven't made it up to Michigan yet. I hope to. We were in Maine a couple of years ago, and we were in Acadia, one of the most beautiful places that I've ever seen. We're driving through Kansas on our vacation this year. Been to North Carolina. Hope to get out to Montana soon as well. So you guys are from some beautiful parts of the country. Um, and you should come to Nashville in Middle Tennessee if you haven't been here. Where I work at, Bridges for the Deaf and Hard of Hearing, it's one of the oldest nonprofits in Tennessee. We were founded in 1927. We are a comprehensive center for deaf and hard of hearing issues. So while we started out as basically a class for people who were hard of hearing to learn how to lip read, we've sort of over the years evolved into more deaf focused. However, we do still support, folks who are deaf, blind, and hard of hearing as well. We have the services mentioned here, in addition to interpreting services, which does provide most of our revenue for our agency to keep working. We also provide social work services, adult education, and outreach. So if you ever would like to join our sign classes that are presented both online and in person here in Nashville, you're welcome to do so. We have adult education and outreach. We have a deaf vice president of our agency who goes out and does those presentations. He can do those virtually. So wherever you are, if you need any, speakers for your staff, meetings, or for your CEs or for your CUs, whatever you need, Mike is always available for that. And we also support deaf and hard of hearing youth. We have 3 offices across the state of Tennessee in Nashville, Memphis, and Johnson City. And which basically, for those of you who aren't familiar, that's West Tennessee is covered in Memphis, Middle Tennessee in Nashville, and then East Tennessee in Johnson City. However, we're not limited to only serve Tennessee. So if you ever have any questions, if you have someone deaf come into your facility and you just need to bounce an idea off of, please reach out to me. My information will be shared in the last slide, I believe. And I've given Jen and Pam the okay to share the PowerPoint. If you were interested in having this for some information, you're welcome to have access to that. Our objectives today that I think were sent out just so you can kind of have a roadmap of where we're going to go. I do want to talk briefly about sexual violence in the deaf and hard of hearing communities. So the patients that come in to need your services, I think it's important for you to have a little bit of background because, like Jen said, this is a community that isn't large. So you may go through your whole career, decades of being in the medical field and not serving someone who is deaf. Now, hard of hearing, that's much more prevalent. We all have grandparents, parents, maybe ourselves who are hard of hearing. But deafness, complete deafness, who rely on sign language and therefore sign language interpreting services, though, that is a pretty small community. But as you'll see here shortly, there's reasons why they may not seek your assistance. But if and when they do, then we want you to be ready. And then we're also going to identify strategies with how to collaborate with ASL English sign language interpreters, basically. So ASL, American Sign Language, that's one of those terms I just recognized that I put that in there on one of the very first slides and didn't give you any context. So ASL is American Sign Language. It's not ALS. That's a totally different thing. And I can't tell you how many providers and nurses I've seen say, do you need an ALS interpreter? And so it's try keeping your heads American Sign Language, not the other or not the debilitating ALS disease. So ASL. All right. So let's talk a little bit about sexual violence in the deaf community. Like I said, it's very, very small communities. So you can imagine, do you have any preconceived notions about some problems that may be within the deaf community? Before we even get started, I'll toss it to you and see if you have any context or ideas. Again, you can come off of mute and just say your answer. If you want to put it in chat, then you're welcome to do that as well. So again, the question being basically just, what are your preconceived notions of, do you feel like it would be something that's prevalent in this community? Would you feel like it's something that may not be as prevalent compared to society at large? Just what are your, and there's no wrong answer. Just let me know what you think.
I think anything that inhibits people to adequately disclose their circumstances puts them at an increased risk.
Mm-hmm. Good. Yep.
Or if they feel like they're not being, lack of a better word, they're not being heard when they're trying to communicate what's going on with them.
Correct. Yes. Very
Maybe
true.
limited interpreters or like the abuser, they're with them being an interpreter, so they're not being that safe space for them to adequately discuss an incident that occurred.
Right. Yeah, very good. There have been instances of, I know of people personally who, when they go into, or when sexual violence occurs within the community, they have been asked to they'll get to the hospital and they'll bring their child with them because it was that type of night or whatever the case was, and they've asked their children who are 6 years old, 10 years old, to interpret for their rape kit or their examination because there's such an ignorance and unknown about, well, we have this little person that signs, the mother signs, we need to get them through. So sometimes actions are taken that aren't appropriate. So again, I'll hit those points a little bit later. But in terms of the prevalence of sexual violence in the deaf community, about 50% is the number that we have people in the deaf community who have experienced some type of sexual violence. So again, with there being a small community, the estimate and the number that we usually go on is they say 5 to 10% of a given, like if you take your state's population, 5 to 10% are going to be deaf. And when I say deaf, I mean completely, profoundly deaf, not just someone who's hard of hearing. The hard of hearing number, of course, is much bigger. But so when you think about, that's not a large number. Um, we serve in Nashville and Middle Tennessee. We serve about it's been anywhere from like 800 to 1,000 people each year, different people. So just in our area, we have about 1,000. So that hits pretty true because Nashville is edging close to 1 million people. It's still, I think, Nashville proper is around like 750, 800,000. But then you take in consideration all of the large suburban areas. So that about rings true uh, for that. So just take your population, and so you already have a small group, and then if you consider half of them potentially have experienced some type of physical violence, that's a pretty large and unbelievable number. Now, if this number is true, and let's say it is, what percentage of those people do you think seek some sort of help or seek services to address the violence that they've experienced? Can you give me just a guess of a percentage of what you think that would be? And we're in working with the deaf community. I'm very comfortable with silence, so you're not going to wait me out very long. I can wait for you guys. So Jamie, 5%.
Oh,
Thank you.
yeah, I was going to tell you, sorry.
That's okay. Yeah. Couple of other guesses besides 5%. 50%. That's quite a range. Okay. Yeah, so folks who actually seek out help, so they've experienced some sort of sexual violence and now they need to go seek help. We actually, Jamie hit it right on. 5% is what we have of people who in the deaf community who actually seek some sort of assistance. So you can imagine them putting up with several instances in some cases over and over again. So the ones that do come to you really, really, and I know that you all do your jobs well, or else you wouldn't be here. And I meant to, in the beginning, say thank you for what you do. Your job is not easy. Your job is, I could not do that. And hear the stories that I'm sure that you guys face every day that you go to work. So thank you for serving the communities and the general population that you do. So when you get someone who is deaf or hard of hearing who uses sign language that come to you, keep that 5% number in mind. It's a very small percent. So they're coming to you with probably some anxieties and hesitations, not just based off of what has just recently happened to them, but just coming into the system in general can often be a big deal for the deaf community. In the mental health work that I do, the number is actually lower in terms of deaf folks who seek out services like therapy services or mental health services. The number is actually 2% for that. So there's a mistrust of just systems that weren't designed for this group of people. So again, I'm going to give you some tips and some guidance on that with how to handle the situation when it does come to your door. This statistic is interesting. We know that boys who are deaf are abused at a rate of 54%, and deaf girls are 50. This is based off of a study that was done by Roger Williams in 2018. So those numbers may have gone up or down, but it's usually compared to about 10% of hearing boys. And when I say hearing, that's another term that we use in the deaf community. Either you're deaf or you're hearing. So hearing is just people like us who have the ability to hear. So it's usually about 10% of hearing boys who have some type of sexual violence, and about 25% of hearing girls, and that's according to the Washington Coalition of Sexual Assault Programs, and this is back in 2015 as well. So if those numbers, if you have more recent numbers, then those numbers may be a little bit off. But the point being that deaf boys experience it at a much higher rate than their counterparts who are able to hear. All right, so I want to talk a little bit about this, and I would really appreciate your all's interaction too. So some of the reason for that 5% number, I have already talked about. The first one is that the reporting systems for those who are deaf, who are deaf in particular, are not necessarily easy for them. Most of them, a lot of things are based on like, hotline phone numbers. Now, deaf people do have the equivalent of a phone, so they can use phones. But in terms of just calling someone up and explaining what happened, is very, very difficult. And obviously, the language barrier is an issue. American Sign Language is considered a foreign language. So it's not, when you see an interpreter working or a deaf person signing, in general, they're not signing every single word that someone says is being signed. It actually is rooted in French. So the whole, adjective noun, where we say, that car is red, and in French they say, um, car red, that they flip it, or I'm sorry, we say a red car and they say a car red, like in Spanish and French, where they flip that. That's how American Sign Language is structured, because the gentleman who brought American Sign Language to America was actually from France. So there's a lot of French influence in American Sign Language. So when you see someone signing, it's not a word for word, equivalent at all. Um, so there's a language barrier. There is a cultural barrier. With the deaf community being so small, um, they're very hesitant to sort of go outside of their community. So they may tell each other these things, but for them to go, and that's very common with any minority community that I'm sure that you've experienced. There is, again, like I said, that there's a mistrust, there's a misunderstanding that these people are here to help me. But with the deaf folks in particular, they fight every single day, you guys, for basic access to their doctors. I just got I mean, that's an everyday thing that I hear, from deaf people calling us saying, I need to go see my doctor. He's not, or he's refusing to provide an interpreter. He wants to write notes back and forth. He wants to use the interpreter on the screen, but their internet's terrible and it keeps freezing up and he won't. I mean, it's a constant fight. And there's actually a concept called deaf tax, and it's just sort of I'm going to show you a sign that may be a good visual. So this is a sign for like a person, right? So you have a person walking or a person running, or so this is sort of like what they use for a person, and then you have this weight kind of over them constantly. So this sign, deaf tax, is just is it's the stresses and just the everyday things that deaf people kind of carry around with them. A lot of times walking down the street, having to be on guard for people coming up behind them, when they're driving, making sure that they're hyper vigilant of what's going on around them. But then also just receiving basic services. They want to go to a concert, but they can't just buy a ticket. They have to buy a ticket, call the venue, hope they provide an interpreter. They get told no, they have to fight for it. They have to say, well, it's the law, you have to provide an interpreter. Then they get pushed back. And so it's constant fighting, it's constant barriers for them a lot of times. So the fact that you're here and that you're interested in this community, I would really like to again, commend you, and please spread the word with whatever I say you can take out in the community and to your colleagues. And again, we're happy to provide this information to you in other areas. There's always anxiety about a breach of confidentiality. I think they understand, the deaf community knows that like doctors can't just go out, and nurses, and can't just go out and talk about patients, and they know that doesn't happen usually. Same thing with interpreters, but it has happened with interpreters before. We are bound by a code of ethics as interpreters. So, and one of the very top tenets is we, maintain confidentiality. And the things I've seen and witnessed, from court stuff to legal battles to medical issues to mental health issues to, I mean, just everything, that all has to stay within me, just like it stays within you. But there's still that mistrust just from, history of hearing interpreters. And then, having to bring a third person, the sign language interpreter into this experience is not something that anyone, I think, would want to have to have, to bring a stranger at some points, bring someone in who maybe you do know, because the interpreting pool is also very small. So the chances of someone calling me to go to a hospital for a car accident or for a rape kit or for something, there's a very high chance I'm going to know who that person is. So these are all some barriers and some reasons why they may not be as open with you at first. Are there any questions about any of these, or do you have any other barriers or anything that you can think of that, or any questions about things that are listed here before I move on? Okay, all right, I'll keep going. When you do have somebody coming to you who has had this traumatic experience happen, not all of these deaf community members are going to come to you from the same journey. You will have people who will be very comfortable, unfortunately, deaf women or deaf men even who have been sexually assaulted or abused, because they've done it twice already, so they know the procedure. So they're not going to be as timid or as reluctant to share information with you. Then you can have people where it's their first time. They were encouraged by a family member or a friend or an advocate to come and seek help. um, most well, actually, I'll hold that information. But when they get to you, one of the very first questions that you need to ask them, and it may not come to your mind, but ask them what their language preference is, because we do have deaf individuals whose primary language is American Sign Language or ASL. But you may have, and so your first thought may be, I'm going to call an interpreter and they'll be here and just, have the 30, 45 minutes. But you may have someone come in there and say, actually, you know what, I would rather not have someone in person. Do you have any, they may ask you for a video remote interpreter or VRI, which most medical facilities have now, but not all. And because they don't want the chance of them knowing the interpreter who's coming in the door, they may they may prefer to write notes back and forth, which is, we try to discourage that as much as possible, because the average reading level of a deaf individual is a third grade level. So it's not only that they may not understand what you're writing, you may not understand what they're writing either, because they will more than likely be writing in ASL word order. So you may get something that says, store me, go to, man, they're hit, or something like that. And while you can kind of piece it together, okay, she went to the store and then got hit. Okay, was that at the store? Was that when she got home from the store? And you don't want to, of course, in this quasi-legal environment, you don't want to make assumptions. So writing notes back and forth is highly discouraged. But you know what? You may get someone who says, let's try notes back and forth, because I just really not comfortable getting a third party in here. Some hospitals or medical facilities have a policy where they require to have an interpreter on site for legal liability reasons. You don't want to have misunderstandings, and you don't want to break your procedures either. So I would see if your facility has anything like that and consult that before making some of these decisions. But some of the modes of communications that they may ask for are an ASL interpreter, which usually means on site. Most deaf people prefer an on-site interpreter because there's just that relationship there. If they're being wheeled around or being asked to scoot down in the bed or set up in the bed, or put their legs in these stirrups, or whatever the case is, having a TV or a video to have to kind of move around and get can be a little bit cumbersome. So, and it's also nice sometimes for them to have a person there who knows their culture, knows their language, and is sort of right there locked in with them. But you may get someone, like I said, who wants a video remote interpreter, who you may have to just sort of adjust the TV or the computer, laptop, whatever you may have, and it's not as flexible or as movable as having someone there on site, but that is an option. There's also something called a deaf interpreter. And what this sounds like is what a lot of people think is when they hear deaf interpreter, they think someone like myself, like someone who interprets for the deaf. When in reality, a deaf interpreter is someone who is deaf who is acting as an interpreter. What the complication that sometimes brings is that you can't have a deaf interpreter generally without a hearing interpreter. So you have you have someone who's hearing like myself. I would sign to the deaf interpreter what's being said or what's being asked, and then that deaf interpreter in the native language, because I learned sign language when I was 18 years old, so I'm not a native language user. A lot of them want to have someone there who knows their language, who has much more access to, sign choices and just that native feel to it. And I always sort of picture this like, if you went to Africa and were seeing, had an emergency, you went to the hospital and they have a nurse that knows English, that learned it later on, but, you're talking about your health in this emergency situation. And then they say, oh, or we have this physician who is from the States. Would you rather have that doctor? You'd probably say yes, because you have that shared culture, that same language, and you sort of have a better concept of just where you're coming from. So they could ask you for a deaf interpreter. Deaf interpreters, again, very, very smaller community or smaller pool of options than even regular hearing interpreters. And then the other category, like I mentioned, is they could just want to write notes back and forth. They could want to type on a computer back and forth and just keep everything that way. And some deaf folks who have gone through higher education are very fluent in both English and ASL, so maybe they would rather have that. You may get someone who is hard of hearing say, I want to just depend on my lip reading skills. We highly discourage that. Lip reading, even the best lip readers that work for the FBI and CIA and all these, the best ones catch 30%. And that is with some context and some, background on what the situation is. There are just so many words that look the same on the lips, and we just highly discourage using that because there's just too much margin for error on that. So, um, if they do ask for an on-site interpreter, ask if they have a preference. Because again, they may have been through this before and Susie was their interpreter last time and did a great job and she wants Susie back again. So you would call the agency and say, hey, is Susie available for an appointment, right now in the emergency room or whatever the case is. So really just give them as much power in this powerless situation as you possibly can. But your first question needs to be asked for their language preference, because we assume a lot that, oh, we know what's best and I'll get this interpreter. Well, maybe they don't want that, or maybe they don't, for whatever reason, or maybe they prefer on-site, or maybe they prefer video. So really, that's if you take one thing away from this presentation, think about ways that you can give them the power to have the communication access that they need. Are there any questions about this section? Okay. Kind of going back to what I mentioned before about how these individuals may come to you, I want to lean into a little bit about just a piece of deaf culture that I think is important, because as they do come to you, that you sort of know where they're coming from, either in chat or you can come off mute again here. Tell me, what percent of deaf children do you think are born to parents who are not deaf themselves? So deaf children born into hearing families. What percentage do you think that is? 75%?
I was going to say 50.
Okay. 25%? 8 trillion percent? 80%? Okay. All right, yeah. So children who are born into hearing families who are deaf, It's about 90 to 93%. All right, so we're talking about 7% of deaf children are born into deaf families, so deaf parents. Knowing that alone, when we're looking at language, when we're looking at, language development, I'll say, can you, what are some just automatic things that maybe jump out to you with hearing parents with deaf children?
Not knowing sign language, like, and how to communicate with their child. Like it's a new learning curve for them.
Mm-hmm. Correct. Yeah, yeah, and that's the point that I was hitting. Deaf children are the only children in the world who are born into families who do not share a common language with them. So as parents, like was just stated, you have a decision to make at this point, right? We have technologies now, obviously, and you're hearing more and more about cochlear implants. Those are families' attempts, obviously and understandably, to say, okay, this happened. I want to be able to communicate with my child, and I've heard this gives me the best way to do that. And that's possible for some people. For some children who are eligible for devices like a cochlear implant or even hearing aids later in life, that's a possibility. If the children though are profoundly deaf, cochlear implants don't fix that. Cochlear implants, to the opposite of what you see on YouTube videos where they're able to hear for the first time and the kid's like, oh, I can hear my mom's voice for the first time, and it is touching and it's you know um, heartbreaking all at the same time. They're not hearing their mom's voice like you're hearing my voice right now. Cochlear implants are very mechanical. It sounds very much like a robot, but that is a step in the direction that the parents want. And we at Bridges do not discriminate. If that's the parent's choice, absolutely, we support that. We do feel strongly that you need to expose children to sign language, as children who are deaf, to sign language at an early age to at least give them something while they are also learning English through their cochlear implants or from their hearing aids. So, but with this statistic, the other statistic that we also know is that the families who learn to effectively communicate with their deaf children, and I say effectively, not just meaning knowing the sign for time for bed, bathroom, eat, drink, more milk, all of those things. The percentage of families are about 10 to 15%. So again, effectively communicate. They may be able to give them directions, but to teach them about proper boundaries, to teach them about abstract concepts, to teach them about relationships, about depression, about proper sexual relationships, to teach them these things. You can see these deaf children are not in general getting that type of language and that type of information. So if that's true, what are the ramifications of that statistic if we're only getting about 10 to 15% of deaf children having effective communication? And I'll give you a little bit of a hint to where I'm going with this in terms of behaviors, in terms of emotional regulation, in terms of boundaries and those type of things. If the children aren't participating in those dinner table conversations or the birds and the bees talks and things like that, what are some obvious ramifications of that? Hmm. Their voice isn't being heard. Yeah.
A sense of isolation.
Yes. And the things that they have to figure out on their own or learn from their peers are things like these. I mean, truly, so, budgeting, yeah, right. Their questions, they may have questions like, why did that happen? Why did this happen to me? And their parents or their guardians aren't able to go into depth, like, with these conversations. So sexual violence, deaf on deaf sexual violence is unfortunately higher than the general population, and we think a lot of it is well, we know a lot of it is because of what we call language deprivation syndrome, which I'm going to talk about here next, actually. But yeah, they're unable to express their experience. So once they get to you, they're not quite sure how to go about signing or saying what happened. A lot of them don't even know that it's wrong, that what was done to them are wrong. Deaf residential schools back in the 40s, 50s, 60s, 70s, all the way up, I would say even to the early 2000s, that is where you wanted your deaf child to go. The instruction is all done in sign language. The counselors use sign language. The material is presented in sign language. So we had a generation of deaf individuals who were sent off to residential school during the week, came home on the weekends if they could, and they sort of had exposure to these things. Deaf residential schools are sort of becoming a thing of, not, I won't say a thing of the past, but they're not as well attended. Most children now are mainstream. Parents want their kids closer to home, understandably. But if the kids are closer to home, if they're not getting this information at home, then they're going to get it from other kids. I've had kids and that they've come home with and saying things or telling me things that they learn from their friends, and it's like, okay, that's all wrong. That's not true. Here, let's have a conversation about this. But you don't have that typically for most deaf children. So I said a term that you may not be familiar with, but language deprivation syndrome. I'm going to show you the next slide, and I'm just going to give you a moment to read it, and then we'll discuss it. Okay, so knowing this now, what do you pull from that, or what strikes you, especially in your line of work? Let's sort of anchor it into your line of work.
Kind of going back to like what you said of not understanding, like for instance, in our field, not understanding their body parts and like what's normal versus what's not, and how to ask those questions.
Mm-hmm. Correct. Yeah, that's basically it. Again, not knowing what's right, what's wrong, what's appropriate, what's not appropriate. Those first 5 years, like that window, we see a very, very, very big, I feel like that's pretty common knowledge, just that window of language acquisition. And most deaf children, they are, most hospitals now are require hearing checks, hearing tests in as soon as babies are born, which is a great advancement. It used to be years ago that wasn't the case, and they didn't find out their child was deaf until they were 3, 4, or 5 years old. If you haven't seen the movie Mr. Holland's Opus, I highly recommend you watch that movie. It gives a very accurate sort of lens into the life of a family with a deaf child. And I think he was, like 4 or 5 or something like that before they started noticing he wasn't responding appropriately. And there's a scene in it where they're at a parade and their child's in a stroller and this fire truck goes by and blares the siren, and you see everyone covering their ears because it's so loud, and you see the little guy in the stroller just sound asleep. So but so we're finding out that children have some type of hearing loss or deafness way before that. So that's good news, but we still have this barrier for them to understand cultural norms and how to express themselves. And right, yeah. So there's a comment that people without language deprivation sometimes struggle to describe their experience or what happened. So if you have people with some language deprivation, then that does make that much more difficult. Sort of under the umbrella of language deprivation is language disfluency. So I'm going to give you just a second to read that. This one's not quite as long. So under language deprivation, language disfluency, basically, so someone in their best language, there's going to be some disfluent factors. This is basically unheard of in the general population, people who grow up in, hearing families. Language disfluency, and we're not talking about people who have like a stutter or a lisp, not those things, but just a disfluency in their primary language. So disfluency in English for most of us. That's basically unheard of. The only few cases that we have are, of the little girl Jenny, who was locked in an attic for years and years and was not exposed to language. Things like that do happen, but it's so minimal. Um, but this is part. Most deaf people, most of them, even educated, have some level of language disfluency. The only ones that don't are those that are born into deaf families where they have a very strong grasp of their native language, of American Sign Language. All right, and then I'm going to let you read a couple of stats here, and then we'll move on to our next section. All right, so now that we know all of this, we can see how important it is to have a qualified ASL interpreter in the room, usually in the room in some form, maybe in person or on video, however your facility does it. But are there any questions about anything we've talked about before I move on to our second and final section? Okay, so working effectively with American Sign Language interpreters. So you've got someone come into your facility, you need a sign language interpreter. Depending on where you are, I feel like a lot of times presenters like myself who are based in Nashville, Tennessee, often have a very narrow view of sign language interpreters because we have about 60 sign language interpreters, not all that work for us all day, every day, but we have about 60 qualified, strong ASL interpreters in Nashville/Middle Tennessee. But we also, Tennessee is highly rural, even though we have Memphis and Nashville and Knoxville and Chattanooga and Johnson City. We do have our little cities, but for the most part, it's very, very rural. The 2010 census marks Tennessee as being 93% rural, or 78. I'm sorry, that 78 of our counties are rural, in compared to 17 that are urban. And I know there are states. I'm from Kentucky originally, and there are no really big cities in Kentucky at all. Louisville, Lexington for me growing up may as well have been New York City because I'm from a really small town, and that was the big city was Lexington. But we know that not all towns and all areas of states have access to sign language interpreters that are 30 minutes to 45 minutes, maybe an hour away. A lot of times we get calls from our rural counties, and it takes us, an hour and a half to get to certain areas. So you have someone who went through this traumatic experience sitting in a waiting room or sitting in your offices there for an hour and a half while so just to even see the triage nurse or to see a provider. um you have 13 in the whole state of Maine. Yeah, yeah. That's probably true. I actually work for an agency in Maine, for a couple of them, and I know that they are calling me a lot here in Tennessee to help cover some of the things needed in Maine. So Maine is also very rural as well, so you can relate to that. Time is, of course, a challenge. And when I say time, I mean time to get interpreters there, to have enough interpreters there, but also not just to have interpreters there, but the second point, aside from ask the deaf person what their preference is for language, the second point I would like for you to take home with you is make sure that the interpreter is qualified to be there. We've had people, a nurse call, oh, this lady interprets at church I see her at church, and here's a deaf person and she knows sign language, so I'm going to call her, and they'll call her directly to come in. There's a story that I like to tell. Well, I don't like to tell it, but I will tell it. I was asked to view a video of a child abuse situation, and they called their interpreter from church to come in, and the police officer was kind of got to a point where it kind of came to a head, and he told the deaf person, "You're a monster, aren't you? Are you a monster? Do you beat kids?" And the interpreter for "You're a monster" signed this, and I'll give you a second to look at your screen. She signed this, and I'm not joking. She signed like that to him in this setting. So she signed monster, like an imaginary boogeyman or something like that. And so qualifications for interpreters are critical. If you're in Tennessee, or if you need help finding an agency near you to partner with, I'm happy to do that. Like I said, do have contacts up in Maine, in Kansas and Michigan. I know some folks. North Carolina, I do know some folks. But if you need help getting an agency, if you don't already have someone established, I highly recommend going through a sign language agency, simply because they're going to know. Like for me, I have a list of 60 interpreters, and then you call me for something in your field, I have about 2 or 3 that I would send out to you. I'm not going to send the other 57 because they're not qualified. Some of them have told me that that's just not something they're comfortable with. They have their own trauma from something like this. And some of them just don't have the vocabulary, the empathy, all of that stuff. So if you need help with that, I highly recommend going through a sign language interpreting agency, just because that way you know what you're getting, and they know and they also know if you say, we have Susie Smith in here who's reported abuse, and we need an interpreter out here. I'm gonna know that Susie Smith hates Eric Workman as her interpreter. Like, she does not want him, so I'm not going to send him to make the situation even more traumatic and more stressful. So we wouldn't send a male interpreter anyway. But you get the point. Like, we would know that Susie and this interpreter don't get along or have had some type of experience. So um, let me help you with that if you need help. When the interpreters do get on site, here are just some things to consider. Ask for their credentials if it's someone who's not through an agency. And obviously gender is a huge thing that you need to consider. I have interpreted a rape kit just from my video work, not because I went there myself, but they came up on the screen and the deaf lady was fine with it. I asked her that. But if it's a female, they're probably not going to want a male interpreter. And if it's a male who's been sexually abused, or undergone sexual violence, then they may not want a female. They may want that male-to-male connection with their interpreter as well. Think about their experience. We have national certifications in sign language interpreting, but I've been nationally certified since 2002, and somebody else may have gotten certified last week. And we both have certifications, and our papers are going to look the same, but you may want to do just a little bit of due diligence, again, if you're not going through an agency. And then again, be open to deaf interpreters. Just be open to it. I'm not, we at Bridges utilize our deaf interpreters quite often because we know that that's the best outcomes. Because again, just that deaf to deaf experience. But if you're from a rural area, you may not. I do know that there's some up in Maine. I've worked with some great deaf interpreters in Maine, but in general, they're not that prevalent. But at least be open to it. I think that that's important. Again, that you're open. Sign language is a very visual language, so interpreters who are trained to do this type of work really know, like the question of um, where did he touch you? Usually, outside of this environment, we would be explicit with that and ask if he touched, and we would probably do breast, private areas, and then because in American Sign Language, that's part of the language is to give examples. So, for example, if you're in court and they say, did he have a weapon on him? There's no sign for weapon in American Sign Language. You would spell weapon, and then you would give examples: gun, knife, bat, and then say or other thing like what. So giving examples is part of American Sign Language. So if you get an interpreter who's not experienced and you just ask a question like, were you touched inappropriately, and they sign things like, were you touching your privates or your chest or whatever the case is, it's going to be a very visual interpretation, so which could trigger more trauma and things like that. So having interpreters who know that. The sign for rape is a pretty violent sign, so trained interpreters are usually taught to spell that word rather than use the sign, which again is a very violent sign. So I say all that to say interpreters need to be trained and have the knowledge to know how to handle those situations, and not all interpreters do have that. So just be on guard for that. And then I see where I'm pressing up against time here, so I just want to show you this. Prep the interpreter so that the interpreter knows what they're walking into. Have a little pre-conference out in the hallway, not in front of the deaf individual, because we don't want the deaf individual to see you and the interpreter talking in that situation, and it's probably not going to be signed at all. And they're wondering what these two hearing people are talking about. What's my interpreter talking about with the nurse? So please allow time for pre-briefings and post-briefings. That's very important. The interpreter is the only one in the room who knows both languages, right? So they're going to let you know and pick up on subtle hints and cues. So like once the session is over, before you discharge the patient home, go out in the hallway again with the interpreter and say, is there anything I missed? Did you see anything that we need to go back on? That type of thing. Videotaping interviews, you obviously wouldn't videotape your actual procedures, but if a police officer does arrive on site and there is an interview of any type, we always recommend recording that so that if there's ever any question, because interpreters do make mistakes, and if someone is already upset and not thinking clearly, they may sign things that are confusing and may not be clear. And then lastly, just allow your deaf center or your agency to support you. Have us come in, or have your local agency come in and do just a quick training like this, just like a crash course on what to do if you get someone in there who's deaf. And we're more than happy to do that. So the last few slides, for those of you who are in Tennessee, just want to sort of, we're divided up into counties. So these are sort of the centers. So aside from Bridges, we have Jackson Center for Independent Living that covers Jackson and those counties there. We have Partnership, which covers the Chattanooga area. The Knoxville Center for the Deaf covers their section, and then Bridges, like I said, Bridges West is in Memphis. Bridges TN is what we call it. It kind of handles the Middle Tennessee, and then Bridges East covers the Far East. And then I do have all of those contact in the counties that they serve listed as well. And are there any other questions? I think we're up against time.